Hello, I am Dr. Hurst, and welcome to the Asepsis and Infection Control presentation. The objectives for today will be to define the term asepsis, explain methods of infection control, define various isolation precautions, and answer two NCLEX questions. So, what is asepsis? Here's the term breakdown. A, as in the medical terminology, means without. And the root word sepsis is invasion of microorganisms that entered the bloodstream or body tissues. And the goal is asepsis. Methods of infection control would be the first thing would be to sanitize hands before and after each patient, practice universal precautions, use proper personal protection equipment known as PPE, and sanitize or discard devices after each patient use. There are various isolation precautions that we all need to take. There's contact isolation, which is transmission by touch. Droplet isolation, which is transmission by cough, sneezing, or talking within 3 to 6 feet of the host. And there's airborne isolation, which is transmission by inhaled microorganisms that are suspended in the air for long periods of time. And the examples would be, for the contact isolation, would be MRSA, which is the methicillin resistant Staph aureus, VRE, which is vancomycin resistant Enterococcus, Versa, which is vancomycin resistant Staph aureus, scabies, impetigo, herpes simplex virus, or blood-borne microbes. And if you come in contact with any of these microorganisms without sanitizing your hands, you can transfer it to someone else by either touching surfaces or the host as the patient. The next one is the droplet isolation, which is usually transferred by influenza, colds, or pertussis. And the last one is the airborne isolation. The examples of that would be TB, viral infections such as COVID, all the poxes like chickenpox, smallpox, or monkeypox, meningitis, and or shingles, also known as herpes zoster virus. So you would use the proper PPE for each one of the isolation precautions. For contact isolation, you would use gown, gloves, goggles, a face shield, a head or shoe coverings. And this would be the case if you come in contact with scabies or like ringworm. You would need to use all of the PEE listed here. but other contact isolated microorganisms, you may need to use one or two or some of the PEE listed. For droplet, you would need to use an N95 mask that include using other PPE. And the airborne isolation would be the same as the droplet isolation, which you would still need to use an N95 along with protect other PPE. And as you notice that basically the droplet and airborne isolation, you would need to use an N95 regardless. And so the summary is the would be is to use the asepsis as a goal to prevent the spread of infection, and you would use hand hygiene as the number one prevention of infection spread, and you would practice universal precautions, which is using precautions for all patients, whether they're on isolation or not. Um, if you come in contact with bodily fluids like vomit, blood, mucus secretions, or even very loose stool, you would put on a gown and gloves and sometimes a face shield. And that's when you would use the proper PPE for all of those universal precautions. And if there's any questions, um, you're welcome to ask any questions now before we go to the NCLEX questions. And here are two NCLEX questions. The first one is that the nurse is caring for a patient with a history of MRSA in the wound of the left leg. Which PPE would the nurse use? Select all that apply. And you would select your answer, and you can share the answers in class. The next NCLEX question is that a patient presented to the ED with fatigue, fever, unexplained weight loss, consistent cough, blood-tinged sputum, and diaphoresis for the past 2 weeks. Once the patient arrived on the unit, what should the nurse do first? And as you can see here, you got 4 questions, 4 answers to select. The first one is A, draw labs as ordered to confirm diagnosis. B, place patient on isolated negative pressure room. C, prepare to apply proper PPE. And D, inform nursing staff on the unit. And you can select the answer, and we can go over it in class. Okay, thank you for watching this presentation, and as stated, we will go over each slide in class.